The greatest thing about our program is our residents and how close they are and how collaborative they are. They get along really well, they do things together, and they really are a close-knit group. And I think that's probably the best thing about the program.
Mentorship is important for residents in the program. I think given the hectic schedule and how fast-paced everything is, it's important for us to have someone or a bunch of people who we can sort of touch base with throughout our day and throughout the year to make sure that things are kind of moving forward in a positive way.
OBGYN residency isn't easy. It's not a walk in the park. I think anyone can agree with that. And so having that support system is so important, and we have this shared experience that we are going through, and everyone is so supportive and fun to be around, and we see each other outside of work, and it's always a good time. And
so in Winnipeg we have 2 tertiary hospitals in the city here, Health Science Centre and St. Boniface Hospital. The area we cover is all of Manitoba, as well as the Kavalik region of Inuit and northwestern Ontario. So with all that huge catchment area, we get lots of numbers, both for obstetrics and gynecology, so we get early exposure and hands-on training.
We have patients from all over the place flying in, coming down for their high-risk pregnancies or any kind of gynecological surgery, their gyne-onc treatments, but then we also have a chance to go up to them. And so a lot of attendings will have practices where they go up to different communities every few months, and we're encouraged and even mandated to go up with them. And so by doing that, we get a lot of opportunities to kind of go into the communities and see what their community is like, and it gives us a lot of perspective, I think, when we're treating them here.
So we've worked very hard to improve the diversity of our intake of students, and I think that's been very successful. We are also working to increase the diversity of faculty and staff, and most recently have established a lead or an office for EDI, and are working hard at things like implicit bias during search committees to improve our performance overall.
Our volume is really high, higher than most programs, and we don't take nearly as many residents. So you get a lot of experience really early on. You get a lot of complicated cases really early on.
We're really fortunate here that we work so closely with our attendings and with one another that I think we're kind of consistently or constantly getting that mentorship. And then in our second year, we're matched kind of officially with a mentor who is able to provide us with both professional and kind of personal advice at key times throughout the year.
I like the city here in Winnipeg. It's smaller, but that means that you can get around the city easily. Traffic isn't a huge issue. It is bikeable or even walking in some cases. It's easy to get to work and home. So the summers are really nice and hot and beautiful. You can get out of the city and go and do the things that you like, whether that's swimming and going to the beaches, or just being outside in a lot of our nice parks. In the winter it's cold, but we got nice snow, so there's lots of activities that people like to do. There's the skating at the forks and on the river. I'm really into cross-country skiing, and there's lots of trails in the city and again nearby outside, so it's easy to get around and do those kind of activities outside of work.
It's important to make sure that people have a life outside the hospital. Make sure that especially people who aren't from the city or aren't from the province get a chance to know kind of what's out there for them to do. Also really important for us to incorporate our families and partners, and for those residents who have kids. So I'm an international medical graduate. I did my medical school in the Caribbean and did most of my clinical rotations in the US. I think I was scared at first that people might have different viewpoints because of where I trained or how I trained differently from people who were from Canada or Winnipeg or the University of Manitoba for their undergrad. And I think that it's been really seamless.
The pathology, the medicine, the volume of medicine, the weird and wonderful things that are seen in Manitoba and truly nowhere else in the country does make our program exceptional.